It takes a certain kind of ambition to do what farmers do. Between the hours and the hard labor to the public scrutiny and bureaucratic maze running, it's not an easy task. While the agriculture industry feeds millions, quietly tilling and producing behind the scenes, many forget that our food comes from the hands of real people with real stories. Join us as we share stories from those with boots on the ground and unearth unique perspectives on agriculture's biggest conversations. It's time to grab your shovel and get to work. I'm Don Schaefer, and this is Digging In with UFA. When we think of farmers, we tend to think of resilient and adaptable go-getters, the kind of people who, when the going gets tough, they get to work. Sometimes we forget, however, that farming can be more than just physically demanding. Between the isolation, the near constant unexpected variables, and even loss on the farm, we forget to consider the mental effects of this challenging way of life. Today we dig in on rural mental health. It isn't easy to acknowledge a mental health struggle. Our tendency to want to just push it away or work through the pain only worsens our ability and our opportunity to be vulnerable with each other, as well as ourselves. When we realize that the truth about our struggles with mental health are more common than we collectively discuss, we can acknowledge and find the support we need to keep going. With more on how to share that vulnerability, this is Leslie Kelly.
I'm Leslie Kelly. I'm a farmer from Water, Saskatchewan. I've been involved in our operation for about 15 years. I am a mental health advocate, and I go by the alias High Heels and Canola Fields across social media. On our farm, we grow wheat, lentils, and canola, and I farm with my husband and my brother. I never thought that I'd be a mental health advocate, but what inspired me was my own family. Everyone in my family has lived with a mental health struggle or is living with a mental illness. My sister lives with borderline personality disorder. My dad, when he battled cancer, lived with anxiety and depression. My brother lives with PTSD and anxiety, and my husband lives with anxiety. 20 years ago, we didn't know anything about mental health. We didn't know how to talk about mental health. We didn't know the resources available. And we felt that we really couldn't talk about our mental health. So by learning more and going through that with my family, and I also went through postpartum depression. So going through all those struggles, and learning and helping each other, learning what support looks like, it really inspired me to try to help other families who felt that they didn't know where to go or were afraid to raise their hand and say, hey, I need help. Do More Ag, I am a co-founder. We founded that in 2018 with the goal to raise awareness about mental health and agriculture. And through raising awareness, building community where people can share their struggles, they can access resources. And then for us at Do More Ag, it's all about bringing those resources to agriculture or to farming communities and farm families. It's a hard process to begin to reach out, but by learning that and even seeing my family go through it, it takes the weight of the world or all those pressures off. And I always felt that through even my struggles, that by raising your hand, it can be hard. But even just the littlest thing, by reaching out or helping someone, I always say reach in, can make a world of difference. It took my husband over 10 years to say, hey, I'm living with something that is making me not feel very, very great. So by having people around you that can see that you're not your typical or your regular self, by saying, you okay? Is something the matter? This seems really hard right now. But then for yourself to say, I feel off. And you might not know those answers or have those answers, but even just the notion of, I don't feel very good today. I didn't feel very good yesterday. I don't know what to do. Can you help? Can you sit with me? And that could lead into so much. And sometimes it's not even really talking about it. Sometimes with my husband, I just sat with him. Like in those moments where he had a panic attack, I didn't know what to say. I hugged him. I hugged him to try to get him to regulate his breathing and know that he wasn't alone. So sometimes it might not be through our language. It can be a simple touch or sitting with someone that you know might be going through a really hard time. Sharing your story, it can be hard. I do it mainly for selfish reasons because of how it's impacted my family. One way of self-care for me is by sharing. It fills up my cup. Then when I get a message from someone saying, by sharing this or talking about this then help them themselves or help them with a partner or someone on their farm, or it helped them look at things differently, that inspires me. I also share because of my kids. I've got 2 boys who may farm, but if they do farm, I hope that they don't go through what my family and I did. That even if they have mental health struggles, I always say it's not if you're going to go through hard times, it's when. And when it happens, that you have resources and people around you that can help you at a time where we felt that we didn't have it. So those are the things that inspire me to share and support those around me. I'm trying to build my legacy is through my family and trying to make my community a lot brighter and healthier when I'm gone.
Part of finding your courage and opening up about any mental health struggle is knowing where to turn. Whether actively seeking an organization on your own or hearing and relating to somebody else's story, it begins with finding your starting line. For some, that begins with kindness and providing a space for others to be earnest. Through our collective experience and our individual journeys, we inspire others and in turn are inspired by each other. For more on creating that space, this is Sean Haney.
Sean Haney, realagriculture.com. I founded the company back in 2008. We've got 11 staff across the country of Canada. We cover ag issues, cover farm shows, conferences, really keep farmers up to date on what is happening in the world of agriculture in Canada and beyond. We do that through videos and podcasts and written content. Also have, since 2016, host Real Ag Radio, which is a show on SiriusXM. Rural Radio 147 is the channel. And do that every single weekday, which is as close as you can get to owning a dairy farm. The show's there every single day for you to tackle and take care of. But I do have a passion for it and love doing it and being able to talk to farmers not only across Canada, but across the United States as well, who are a bigger and bigger part of our audience. I grew up on a farm just north of Lethbridge, Alberta in Picture Butte, which is the feedlot capital of Canada. We had a feed yard. We had a seed business, a seed processing facility. And we exited that in 2019 and focused on real agriculture full time. I was the most mechanically uninclined farm kid known on the face of the earth, right? But I love the industry and everything about it, so I get to talk about it, which is my participation. There's a lot of different roles in the world of agriculture. There's scientists, there's marketers, there's executives, there's producers themselves, and then there's people like farm broadcasters, which is a unique position that I get to take care of every day.
When you design a public platform to engage with your community, you build a space for people to share their stories. You're offering an access point for personal growth, and it starts with somewhere to go.
I think we're communicating, and that communication has to be a two-way street, so to speak. It's not just a one-way, like you're in a big city. I think it's important because obviously there's the mantra of this is where your food comes from, but it's important that we understand what their challenges and what their thinking is, as well as we try to make sure that we're producing the products that consumers ultimately want to buy or how they want them produced. The challenge here is that the consumer is, just like the farmer, is not one entity. It's not this one individual that we are trying to market to. They're diverse from an ethnic standpoint, from a sex standpoint, a background standpoint. What they're interested in is very diverse. No different than farmers and ranchers across North America are very diverse in their own operations. And so there's a real challenge here, and you can see why the communication at times is really broken down. And it's not as clear and as compact and as succinct as it should be. I also think it's important for the industry to communicate with urban people that maybe are a few generations away from the farm, because we have a huge shortage of labor in the industry. And we've kind of tapped out the farm kid access point where we really didn't have to recruit people into the industry because we just recruited the people that maybe didn't want to stay on the farm, or maybe people like that. And now we've got to recruit more people into it at the primary level, the production level, as well as in the C-suite. So I think it's in our best interests to be participating in programs like Ag in the Classroom, 4-H are great examples of way to connect with that consumer audience. I feel very fortunate that I get to talk to so many ears and eyes on a daily basis. And I wouldn't say that I'm trying to convince them of something, although I do have my biases and I do have my standard rants that, particular pet projects that I definitely like to talk about. It's really about exploring what the issues mean to their individual farms and then helping them come to conclusions in terms of how they feel they should feel about that issue, whether that's policy or it's new technologies or it's a regulation or it's a trade related thing. Really trying to present as much of a objective, kind of maybe both sides, or trying to make sure that we help them, as long as they're curious. I have a great opportunity to help them learn about a whole bunch of different subjects. That's what I really do love, is that exploration of a topic and trying to bring it back to how, this is an issue that's happening in Iowa, or this is an issue that's happening in Ontario, but this is what it actually means to farmers in Alberta and why you should actually care about it potentially, because it could have impacts on you. Or there's a parallel sort of issue that's happening here in Alberta. And so this is our way to learn from some other areas. So that's what I love most about this role.
When we talk about mental health in the agricultural space, what does that mean for farmers specifically? We can speculate on what might be the leading conversations coming from the farm, but what are we actually hearing from farmers themselves?
Well, you definitely have to have adaptability in agriculture. Farmers and ranchers have to engage in that. No 2 years are the same. I don't care if you're in livestock or you're a cropper or whatever you're doing at the primary production level. Last year's problems are not this year's a lot of times. You look at 2021, terrible, terrible drought across a lot of the Western Canadian prairies. But then we've also had years where we've talked on our shows and our website about what do we do with all this water? I don't know what to do. It's too wet. We can't harvest. We can't plant. We can't seed. Or there's new weeds or there's new things that are being presented as barriers. And so you do have to have adaptability. You do have to be curious, and you got to try to build resiliency into your operation. I think a big misconception is that farming is the most stressful occupation or industry that's known to the planet. It is very stressful and it has its major challenges, but there's a lot of industries that have some of the same challenges, and people that are in it go through some of the same things. So I think a lot of times we could learn from some other industries in terms of how some of the stakeholders and the participants deal with things like stress and anxiety, and even in the worst situations, burnout, because those things exist in other industries and they also exist in ours. And so I think a lot of times we sometimes think that we're somehow isolated, that we're different. Farming is different. It is in some senses, but in other ways not.
I just talked to a farmer last week, and a misconception is, and he framed it as, would you ever quit farming due to your mental health? And I thought that was interesting, and just how it was framed in the sense of there's lots of shame and blame when it comes to mental health. But if we rephrase that into, if you were to retire from farming, because I always think of like If you take a professional athlete and after a 10, 20-year career, they might be burnt out, fatigued. We would never say, hey, they quit basketball or they quit baseball. They retired after a great career. It just wasn't for them anymore. So I feel like there's lots of misconceptions as to reasons why a farmer may retire from farming. And one of those might be, and it's okay, it might be mental health. Other misconceptions that I've learned is mental health is just as important as physical health. We talk a lot about our physical health on the farm and accidents, but there's a mental health component in there with lack of sleep, fatigue, decision-making, all of those things.
Leslie, I would probably say that one of the misconceptions is that self-care is not important. A lot of people make this sort of statement that with a lot of pieces of farming and ranching, you're outside. So you're getting the vitamin D, you're getting some sunlight. That's great. A lot of people that are office jockeys don't get an opportunity to do that. The other part of it, though, is that just because you're outside doesn't mean you're actually taking care of yourself through things like exercise. And there's definitely the eating component that could really improve. There's also things like alcohol and the overuse of that in some situations because people are so isolated. Self-care, I think, is something that doesn't get enough talk inside agricultural circles.
One of the things that I learned, like before when we started talking about self-care within our family, I thought self-care was bubble baths and yoga. And then I've learned that self-care is more than what we see on really nice Instagram posts. Like self-care can be messy and it can be hard. Self-care is me doing months of books that I don't want to do, but afterwards it makes me feel really good. Self-care is going to the doctor, it's going to the dentist. It's things that can be hard, but beneficial over the long term. It's more than, and I love bubble baths and I love yoga. But for me, like when I started talking about it, my husband said, I don't like bubble baths and I don't do yoga. So what is self-care for me? And it changes. We always think like, that worked one day and it's going to work for you the rest of your life. And that might not be the case. Self-care is fluid and it changes in the season and it changes with what you're going through. I've learned misconception is boundaries in farming. We can't have any. And it's really important to figure those out. Some boundaries that we have on the farm, and those were some uncomfortable conversations, but some boundaries might be how you set up your farm different than maybe your family member, the use of equipment, physical boundaries. For us, some of the boundaries too are in how we work together. Sleep is very important. So for us on the farm, a boundary for us is we like to shut down the operation at night so we can go home and have a rest, depending on weather and circumstances. But that's a boundary for us that we need to have to be healthy.
One of the factors that does make agriculture different is the isolation, right? So if you are in the middle of nowhere, Saskatchewan, that physical isolation, there's great things about the isolation, right? I don't need to deal with traffic. I don't need to deal with people. I just can do what I love to do and I'm good, right? But there's other sides to that too. And that lack of human connection sometimes, especially if somebody is going through some challenging personal times, especially on the mental health side, that isolation can work to your detriment. That is one of the things, unless you're a deep sea fisherman that probably has some of the same sort of isolation over an extended period of time, there's not a lot of industries that are as isolated for some people as farming.
So on our farm, we made a decision because being very extroverted and knowing I'm self-employed, my husband would be on the farm and would not leave the farm. And that is okay with him. For me, that would be very difficult for me not to see people, especially in the winter. So we made the decision knowing that where we were going to live was a half an hour away from anywhere, made the decision to live in town so I can look out my window and see people and run to the hockey rink in 2 seconds or walk downtown and see my neighbors. That was a definite decision that we made for the family and for our mental health in terms of the isolation factor. For us, it was being very isolated out in the middle of, we call it the sticks. The other reason was just risk. Moving to the farm, building a house on the same quarter as a family member and not knowing if this was going to work out or not. And then there would not be an option to leave. It would be very, very hard. So it was a financial decision and a boundary decision.
Also, access to amenities, whether that's being able to just rip down to the grocery store, not going to Costco once a month, and that's about the only time you go down the food aisle, or access to hospitals, access to schools. There's a lot of things I think go into the factor. I think the mental health side is more of a side benefit than necessarily being the main driver.
In condensed urban areas, it's safe to say that access is more readily available. Whether the proximity to care centers or the concentration of more mental health professionals, access to care in rural settings is a bit more of a maze run. But seeking out help begins with a willingness to take the first step. And sometimes that is the hardest part.
I can't compare to someone in the city because we never did access services while we were living in the city. I do know that if you live in a rural area, your access to in-person mental health professional support is 8-1 compared to that of someone living in the city. Just our access to professionals is very limited. Going through all of our family struggles and the different mental illnesses and the different mental health challenges, it's hard. It's hard to get in to see someone. It's hard to know who that someone is. It's hard to get a diagnosis. Some of these diagnoses, like my sister, it took her over 10 years to get properly diagnosed. And then for us on the farm, it can be frustrating because if you do have an appointment and you want to see someone in person to connect, that might take multiple times. So that's multiple trips into the city. You might not feel you can shut down at harvest or seeding. So then you have to postpone those appointments. And in the meantime, then you're calling crisis lines and mental health service lines and having to retell your story. It can be very frustrating. But I always tell individuals from our just personal experiences, just keep trying. If you don't connect with someone, or if you are meant to see a psychiatrist versus a psychologist, just keep trying. Just keep asking those questions because eventually that road will lead you to someone who can make a world of difference for you. You have to keep trying to navigate in the system because it's hard. Going through cancer with my dad, where he had your one doctor that navigates through all the other doctors and specialists, I wish we had that in mental health services. But that would take an overhaul of the system, but it would make it less stressful in an already stressful time.
I think for anyone urban or in a rural situation, a lot of it comes down to your internal will and desire to want to try to get some of that assistance, right? If you're going to stop at the first roadblock, the first barrier, I don't care urban or rural, that's going to be difficult for sure. So I think one of the good things is I know through like our company medical plan or health plan, there's a lot of telemedicine tools that are available to people, even on the psychiatry side and things like that, even access to things like psychotherapists if it's that kind of a situation. So I think that those kind of tools are good, especially for people in rural situations where you can get some of the best leading edge help from some of the big metro centers. They don't have to be in the local small town, because I think one of the barriers here is in a local small town, word spreads quick. And that's a barrier for a lot of people. I really don't want everybody at the coffee shop to know that you're really stressed out. I think I may sell my farm because I just can't do this anymore. That stops people from traditionally, I think, historically engaging in conversations. So sometimes you want to go as far away as possible, where nobody knows and word's not going to travel and no one's going to care. They just want to help. So yeah, those kind of tools I think are really popular and positive for the rural industry.
Understandably, these conversations aren't the easiest to have. The initial steps in realizing something is wrong and vocalizing can be exceptionally challenging, given public stigma around the idea of needing help. A deep fear of feeling less than or looked down upon because of issues that had to be trivialized in cultures past adds another barrier to entry on the journey forward. And when we look at mental health for men specifically, the expectation to be even stronger and more resilient amplifies that difficulty even further. How do we change public perception and expectation? Where do we begin?
I think a big part of the stigma or some of those barriers is human nature, that it's always going to exist. Leslie may have data on this, but I think it's a lot better in agriculture than, say, 5-8 years ago. I would say whatever timeline, I think there's been a lot of improvement, and Leslie's been a big part of that in terms of trying to educate people and get people to understand the topic a lot better. More people are kind of being honest about it too, in the sense of, oh yeah, my dad this was going on and I knew there was something wrong. So I think we shouldn't be so hard on ourselves as if nothing's happening. I think a lot has happened. There is room for more improvement, don't get me wrong, but we've come big strides, I think.
Yeah, and it's like growing up, we've seen the negative association with mental health. So growing up, when anyone talked about mental health, I always thought it was mental illness because I just thought that was what mental health was. And it was woven into the fabric of who we are through decades of negative association within the media, within TV, within movies, within, hush conversations at Coffee Row. So that just doesn't change in a couple of years. That will take time. And I honestly didn't know when people were talking about the stigma. I'm like, what does that even mean? Like, I didn't know what it was until we went through it. And I remember my husband and I shared a video. We thought, okay, so if we share this video, what could happen? Not saying that it would, but what could? And we, outside of like the fear of what people might think and Coffee Row chatter, when it comes to farming, we were afraid of our operating line being gone. You're deemed a high risk, so you're done. What could affect our insurance? Could our insurance be gone? And then I went, oh, that's the stigma. We were worried if people would go to our landlords and tell them that we're crazy and insane and our rented land be gone. And then that is what made us go, wow, in agriculture, that's part of the stigma that we talk about. None of those things did happen. But for me, the stigma is the fear of it. I always think I was a curler, and our team went from being good to even better when we had someone come in and talk about mental strength, mental toughness, mental health. And I always think, like, how cool would it be if our farm teams, we have farm teams on the legal side, accounting, agronomy, service, equipment, like how cool would it be if we also had someone to come in and teach us more about how we can change or enhance our mental health on the farm and how it's woven into the fabric of the farm. I think if we ever might get there, or maybe one day, that stigma will eventually be uprooted.
Yeah. And there's always going to be stress in farming and ranching. That's never going to be eliminated. It's how you deal with it and your capacity for stress when it does come in larger loads is, building that muscle, so to speak, in terms of dealing with stress. And some of the times that we do go through in agriculture is really the important thing. And that's the pre-work, so to speak, not just the reactive work after the fact when something's really wrong, right? So, and that's where some of the self-care comes in and things like that.
I believe Farm Management Canada, they did a survey on stress, and women in agriculture, or women on the farm, had higher stress amounts. So I don't feel like one has it more or less. I feel like between the social aspects, the gender aspects, we carry it differently. So with the women, they were carrying the stress due to workload, finances, and the well-being of the farm and their counterparts. My husband, he gets stressed about equipment blow-ups, getting the crop in, getting the crop off. I get stressed when they are stressed and trying to take on their stress to help them. So I feel like roles are different, farm roles, and how that stress impacts that person gender-wise, if that makes sense.
Yeah, this is a deep one to step in. I think Leslie did a good job in terms of it's not one's better off or worse than the other. The expectations can be different, which creates some of the challenges for men or women. At the end of the day, the common thread amongst both of them is what do you do about it? And how you deal with it is, I think, the most critical. And that's where they're really in parallel. But whether or not someone's male or female, it doesn't make one more inoculated from the issue more than the other, I don't think. In July, the market research arm of Real Agriculture, called Real Agri Studies, every quarter we ask farmers about their level of how do they feel about their mental health relative to 12 months ago. And 100 is neutral. It's a scale of 0 to 200. And since September of 22, when we started this, that number's been around 100. And so there's been a lot of ups. Businesses were a lot more profitable in agriculture in 2022 in September than, they're thinking about what the 2024 or 25 crop looks like. So it really has been rather stable. So I think that's positive. So in July, we asked farmers, what are some of the things they're doing to deal with some of the mental health issues they may be faced with, or help try to keep that number as high as possible? They mentioned 7 things. It was an open-ended, and they mentioned 7 things. So one, in no particular order, one was faith and spirituality. Some individuals rely on religious beliefs such as Christian faith to stay grounded. That grounds them. Positive thinking was another. 3, social support. 4 was work projects. So engaging in improvement projects on the farm can be a productive way to cope with stress, right? Some sort of like a side thing to get your mind off of some of the daily challenges. Also, material comforts like upgrading equipment, some of that retail therapy, so to speak. One of the other ones that was mentioned was substance abuse. Some respondents mentioned things like alcohol consumption or things like that as a coping strategy. So a little bit more of a negative coping strategy, moderation. And 7 was perspective, realizing that challenges are a part of the cycle and trying not to overreact to temporary difficulties helps others manage their mental well-being. So those are the 7 things that farmers said to us.
If someone is ready to express their needs when it comes to mental health, who should they look to? Where should they start?
I always think reach out to who you're comfortable with and what you're comfortable in doing. Sometimes that starts with you just saying, at the end of today, I gave it my all and my best was good enough. My best might not be as good as it was yesterday, or it might not be as good as it will be tomorrow, but I tried my best. So giving yourself a lot of grace and patience during those hard times. There's lots of services. There's what Sean mentioned through telehealth. There's crisis lines. There's peer-to-peer online social support groups. There's agriculture-specific counseling groups and programs. Your peer group. A lot of farms are in peer groups. Peer groups might be within your community, it might be within your province, or it could be even outside of the industry. Support groups, your friends, your family, people online that you can connect with, just some people that will, because we can get caught in that negative, you want to go and you want to vent, but help those individuals through not only just the venting, but also encouraging them, being there to talk with them, being there to listen with them, being there to sit with them. And that might look and feel differently depending on where you are and what you need. So there's a lot out there. There are websites or places like Do More that can help you navigate where that help might be. The one thing that I would end with is that I love farming. I am grateful to be a farmer, to do what I love with the people that I love. And I get to work with not only my partner in life, my family partners, but also my kids. So I'm very grateful. But with that, it can also be stressful. And going through what my family and I have been through, for someone to take away that there is hope out there and that there is help. Everyone's journey is different, honoring everyone's journey, but there are people that love you and will help you get through it.
The one thing I would leave everybody with is the way that I look at this is that this is not like a finite process. This isn't like, okay, I did these 5 things, mental health fixed, I'm good, right? It's not a growing season of a crop. This is an ongoing thing, and you need to be less outcome focused and more process focused. So what are the things that I need to do today, this week, this month, in order to improve the probability that the outcome is going to be what I want it to be? So whether that's, some people say, hey, I know I need to exercise in the morning. Some people say, I know I need, read the newspaper and have a cup of coffee in the morning. Some people say, X, and some people say Z. It's a personal thing. Sometimes I think a lot of times we get too wrapped up in, well, so-and-so does this, so that works for them. This must work for me then. I think you need to think about much more of a personalized plan. So don't think outcome, think process. And it is a work in progress to try to find what works for you, but you got to stay at it.
If you or somebody you know is struggling with mental health, don't hesitate to reach out to someone you trust, whether that be a mental health professional or simply a loved one. There are resources and pathways forward. Life can be different. You are not alone. At the end of the day, we look to our resiliency within ourselves and our communities to make our collective futures as bright as possible. All it will really take is conversations like these, some vulnerability, and a little digging. Thanks to the support of UFA Cooperative, we're able to share stories from those who live and breathe agriculture. We'd like to thank our guests for sharing their insight into the future of agriculture and for being with us today. For more information and a new episode every month, visit UFA.com. With listeners like you, we'll continue to dig a little deeper here on Digging In with UFA. I'm Don Schaefer. Thanks for listening. Another Everything Podcast production. Visit everythingpodcast.com, a division of Pattison Media. Subscribe wherever you get your podcast.
The views expressed in this podcast reflect opinions and perspectives from participating guests and not necessarily those of UFA, UFA Cooperative's membership, elected officials, or stakeholders.